some tips about fat transfer. So today's patient, she's in surgery now. I'm in Texas. She's having a lower face and neck lift, upper blepharoplasty, lip lift, and she's having fat transferred around her face, or fat grafting. So it's a little bit of liposuction, and they usually take it from your stomach or your thighs. And I would say it's about 50-50 with my patients, stomach or thighs usually. If I do my job right, and this is how I'll know if things are going really well, is the most uncomfortable thing that's bothering her is where they took the fat from, which is easily solved with just like an ice pack. Just pop a little ice pack on there and it numbs the pain super quick. Now, the reason I like to use cool compresses, oval cool compresses on their ice instead of ice packs. Let's talk about that. So I like to use not rounds, but cotton ovals. And the reason is it's super soothing and it keeps early swelling down in the orbital area. So it's great for the blepharoplasty, but also because it's an oval, it goes down a little further and it covers this area where there's usually, I won't know till I pick her up, but usually they put fat under the eye to kind of fill in this area that loses volume as we get older. I'm talking fast so I can get all this in. So I like to use the cotton ovals. Clean bowl of ice water, dunk them in, squish out, wring out some of the ice water, and then put them on there. It's super soothing. I use this even if patients don't have any work done to their eyes because it's so soothing. But here's the cool thing. Instead of using an ice pack, so if I used an ice pack, after 20 minutes, I would have to remove the ice pack. The thing with these cool compresses dipped in ice water is I put them on the eyes. They don't stay super cold for longer than 20 minutes, which is brilliant because I'll put them on her eyes, she'll fall asleep, and then I'll leave them there. And then when we're due for more cool compresses or more ice, usually it's every hour. Sometimes it's 15 on, 15 off, 20 on, 20 off. Your surgeon will tell you. Then I'm going to leave them on there. She'll fall asleep, and then I'm not waking her up by taking them off. I'll just leave them on there till we're ready to give her more cool compresses. And so it's kind of this delicate dance of letting her rest and doing my job, but letting her rest. Some patients, every time I even, touch them or come near them, they kind of like jolt awake, and then they're not getting really restorative sleep. And so I want to make sure I'm kind of disturbing her as little as possible. So I'm going to put them on, leave them. They're going to get room temperature. I'll just leave them on there. And then when we're due for more, I'll swap them out. So what else? You want to make sure you stop icing when you're supposed to stop icing because you want to get established good blood flow. And so usually it's 48, I might have already said this, 48 to 72 hours. Your surgeon will tell you, make sure to follow the rules. I hope you plan a great recovery and love your result. My patient is lovely. We're doing a hotel recovery for the first night, and then tomorrow I'm driving her home and I'll be with her for I think 5 to 7 days. So thanks for watching.